Scoliosis is more than just a curve in the spine. It can touch many parts of a person's life. There are different types of scoliosis. But here we will talk about how to manage it. The curve can sometimes cause back pain. This pain can make daily activities hard. Simple things like sitting at a desk, walking. For some people, the pain is mild. For others, it can be strong and constant. We must always listen to our bodies and address this pain. It is an important signal that something needs attention. The spine is very close to the ribs and lungs. When the spine curves, it can change the shape of the chest. This change might affect how the lungs work. A large curve can sometimes make it harder to breathe deeply. You might feel out of breath more quickly during exercise while resting. This happens because the lungs do not have enough space to expand fully. Taking care of your breathing is a key reason to manage scoliosis. Good breathing helps your whole body get the oxygen it needs to be healthy and strong. Scoliosis can also affect how you feel about yourself. A visible curve or uneven shoulders can make a person feel self-conscious. This is especially true for teenagers, who are growing and changing. They might worry about how they look in clothes, what other people think. This can impact their confidence and self-esteem. It is important to remember that you are not alone. Many people live full and happy lives with scoliosis. Focusing on what your body can do, not just how it looks, is a powerful step forward. Understanding these effects helps us see why treatment is so important. We are not just trying to straighten a curve. We are working to reduce pain, improve breathing, boost self-esteem. Braces are a common treatment for scoliosis, especially for young people. A brace is a special vest worn around the torso. Its main job is to stop a spinal curve from getting bigger. Doctors often suggest a brace for children, teenagers who are still growing. This is because their bones are soft and can be guided. The brace works by putting gentle pressure on the spine. That pressure holds the spine straighter while the child grows. A doctor will recommend a brace when a curve reaches a certain size, usually between 25 degrees, 40 degrees. The person needs to still have growing left for the brace to work. Example: a 12-year-old girl had issues when she noticed her clothes fit unevenly. Doctor found a 30-degree curve. Because she was still growing, she was prescribed a brace. Maria was told to wear it about 18 hours a day. Big commitment, but more effective that way. A brace can stop a curve from progressing. It usually does not make the curve smaller. The goal: hold the curve until growth stops. Wearing a brace can be uncomfortable at first. It can feel hot, tight, restrictive. It can also cause skin irritation if not fitted or kept clean. Getting used to sleeping, getting used to moving in a brace takes time and patience. Follow the doctor's instructions. Wear it the recommended hours. If you don't wear it enough, it won't work. Have regular checkups with your doctor. Doctor checks fit and takes x-rays to see if the curve is stable. Bracing is a partnership between you. Surgery is usually considered only when scoliosis is severe or getting worse quickly. Doctors typically think about surgery when a spinal curve is greater than 45 or 50 degrees. At this size, the curve is more likely to keep getting bigger, even after a person has stopped growing. The main goal of surgery is to stop the curve from progressing further. The surgery also aims to reduce the curve and balance the spine. This can help improve breathing, reduce pain, restore the body's alignment. Surgery is a big decision, and it is reserved for specific situations. The most common surgery for scoliosis is called spinal fusion. During this procedure, a surgeon attaches rods, hooks, screws to the curved part of the spine. These tools help to hold the spine in a straighter position. Then, the surgeon places small pieces of bone, called bone grafts, along the corrected part of the spine. Over several months, these bone grafts grow together with the vertebrae. This fuses the bones into a single, solid piece. Once the fusion is complete, that part of the spine will no longer curve. Deciding to have surgery requires a very careful discussion with your surgeon. There are many benefits, but there are also risks. The surgeon will explain the possible complications, such as infection problems with the hardware. They will also talk about the recovery process. Recovery from spinal fusion takes a long time. You will need to rest and avoid certain activities for several months while your spine heals. It is a major commitment for both the patient and their family. You must weigh the potential benefits against these challenges. Surgery is not the right choice for everyone with scoliosis. Most people with scoliosis will never need it. It is an option for those with large, progressive curves that do not respond to other treatments like bracing. The decision is a personal one. You and your family should ask your surgeon many questions. Make sure you understand every part of the process, from the operation itself to the long-term outcome. A good medical team will support you in making the choice that is best for your health and future. Most exercises focus on enhancing bodily functions rather than bringing about structural changes. For example, they aim to improve muscle strength, flexibility, cardiopulmonary function, and stamina. While these exercises may lead to structural changes such as muscle growth and fat reduction, they do not significantly improve body misalignment or scoliosis degree. These exercises include yoga, stretching, Pilates, weight training, core training, aerobic exercise, swimming, and more. The most effective exercise programs for improving scoliosis involve actively training the brain to control body movements. This requires precise coordination of different body areas and movements to correct the deviation direction of scoliosis, improve posture, and correct the degree of curvature. These programs, such as the Schroth method from Germany and the Sees method from Italy, require the guidance of a professional spinal correction therapist for assessment and treatment.
If you have structural scoliosis, small targeted moves can make a big difference. Add suction cups to lift and free tight tissue. Here's how. Start seated or standing tall. Place silicone cups along the paraspinal muscles where tension feels strongest. Lightly suction each cup so it grips without pinching. Inhale. Lift your chest. Squeeze shoulder blades together. Hold 2 seconds, then exhale and relax. Repeat slow rows of 8 to 10 reps, feeling the cups lift and release fascia as muscles lengthen. Finish with gentle side bend to the left, then side bend to the right. Cupping helps the tissue glide. The exercise builds balanced strength for spinal stability. Check with your practitioner to tailor intensity and frequency.
Small daily changes can make a big difference. For spinal health, let's keep it simple. Do. Stand tall. Sit straight. Posture matters. Do. Keep moving. Short walks, core-friendly exercises. Do. Check your sleeping position. Avoid weird twists overnight. Don't. Carry heavy loads on your back. Use a wheeled bag. Redistribute weight. Don't. Overdo certain sports. Avoid long-distance running. Avoid trampolining. Avoid ballet. Avoid rhythmic gymnastics. Quick win. A flexible high school gymnast improved after doing a caterpillar exercise consistently. Note. Swimming helps, but watch for uneven force on each side. Eat well. Calcium, vitamin D. Balanced nutrition supports spine health. Small habits, steady progress.